Yeah. So Jerome wanted me to talk about what's in pipeline, future of lenticle-based surgeries. I think few of the points I think Kala already been spoke, but still I want to brush upon. See, we started PRK in way back 1995. Then later on in the 2001, the femtolasic has been introduced. The flex, what I showed, which has been started in 2007, but Smile started in 2011. So I started Smile almost around 2012 or 2013. So USFTA for Smile for spherical correction 2016, 2018 for compound myopic astigmatism. So what exactly the definition of CLEX? CLEX is a keratorefractive lenticle extraction which was proposed in a joint editorial statement in the Journal of Refractive Surgery to encompass all the preparatory terms for corneal lenticule extraction surgeries for refractive error correction. This is CLEX. So we have got flex also, you got relax, you got smile, you got silk, you got clear, you got smart light also. So smile, silk, clear, smart light comes in the CLEX classification. So these are the smile is small incision lenticular extraction. Silk means smooth incision lenticular keratomiliasis. Clear means corneal lenticule extraction for advanced refractive correction. Smart sight is smart small incision guided human cornea treatment. So we started with Visumax 500, the frequency of 500 gigahertz, intrastromal refractive lenticular extraction. Basically a flapless procedure, no ablation, no flap. Then it's a single step, one step procedure with a single system. It has got the Smile machine Visumax 800 has got a computer in it, laser arm, vacuum system, microscope and foot switch too. This is how it works. It has got a low pulse energy with a high pulse frequency. So I will not talk about spot sizing between 2 to 4.5 microns. Track spacing distance between the two laser spot is adjacent track is 2 to 4.5 micron. So scan direction is conventionally spiral in for posterior plane and spiral out for anterior plane. So there are three modes are available. I am not going to talk about. One is standard mode, one is fast mode and the expert mode. These are the surgical step already showed in my previous step. So I am not going to talk in detail about the surgical step of smile. So basically, as I said that this is the cross section, how exactly smile looks in the slit lamp. So this is the, again, I just want to brush you up. This is the basic, the first video I have done, it is almost around 12 years before. Started with the, how, with the lenticule cut, followed by the cap cut and the incision. Identifying the proper layer is very, very important. First anterior layer, then posterior layer. Dissect the anterior layer like a something like a windshield wiper movement. Then go to the posterior layer. Then try to dissect both the side equally. Then you can take out the lenticule even with the simple forceps. Put it on the cornea. Look for the integrity of the lenticule. So other platform I want to touch upon here is first is the Zimmer. So Zimmer newly developed something called with the help of their femtosecond machine, Femto LDV Z8, which can now they are changed into a Femto Z8 Neo. The advantage that is the treatment what it is done is clear. There is a corneal lenticule extraction for advanced refractive correction. So what they claim, it has got a low energy, smooth dissection of lenticule and cyclotorsion compensation also there. But again, it is not been FDA approved. So coming to the Swind Etos Smart Sight. So the advantage, it has got an intelligent eye tracking system with a cyclotorsion compensation with a more tissue saving, which is compact and flexible and smooth and tissue saving. Again, the machine still it is not FDA approved. So what exactly we do in Swind Etos, the microcut technology, it exhibits something called a homogeneous surface. As a result, lenticle extraction will become simple with a precise treatment. So now comes what Dr. Kala was talking about, the Johnson & Johnson Elita. That is, it do the silk, that is the smooth incision lenticule keratomiliasis. So it has got a, because of the ultra precision pulse, better quality treatment and ultra fast delivery, exception is smooth surface, and also it is with the superior optical performance. The most important, probably they claim that in industry there is a first biconvex lenticule it has got. So because of that, the less corneal folds in the Bowman layer and leading to improved nerve degeneration, less cutting of the corneal nerves, and fast regeneration. So now I think as I started looking at the Visumax 800, there's something called Smile Pro with 2000 hertz, faster performance, faster cut speed, with the cyclotorsion compensation, central align, easy patient access, but the treatment time in Visumax 500 is around 30 seconds. Here treatment time is less than 10 seconds, so there is absolutely no question of suction loss. But the most important, now they incorporated hyperopic treatment in this particular. So what is there in pipeline? So as our initial speaker was telling, about can we do a secondary smile? They have been working on, especially you can do the previous secondary smile on the previous smile cap. You can go below the previous smile pocket. We need to further trial is still going on, but we are thinking about subcap lenticular extraction. That is something called modified repeat smile, which can be performed at the same depth as the first procedure without anterior cut, with a previous interface which acts as a superior border. I know that it's technically challenging. So this is a small comparison with the other platforms I just wanted to show you. With the Smile Pro, Silk, the Silk with clear and smart light. If you see here, the treatment range for Smile is -1 to -10, but they are given me the license of even up to 14 only for trial purpose. Cylinder which has been up to 3, that is what the FDA approved. But Silk you can treat up to -12, cylinder up to -6, clear you can do up to -10 spherical with -5 cylinder, and the smart sight -5 to -12 with the 6 cylinder. But in Smile also you can go up to -4.95. So cyclotorsion compensation was not there in Visumax 500. Now it has. This is a comparison with the Visumax 500 I am giving you with the Silk, clear and smart sight. So cyclotorsion compensation was not there in the Visumax 500. Now it is with the Visumax 800. Then all other machine it has got a cyclotorsion compensation. Pulse energy again with the Visumax 500 was little bit higher when it's compared with the clear. So what I think yet the results yet to come for, I think probably 4 to 5 years of comparison with the other platform. What they say that if you got any machine with a low pulse energy, that reduce the collateral stromal disruption. So we need to look into the coming time. Then pulse frequency, if you see here, I think so Smile has got a very less pulse frequency, but always what they say that higher the pulse frequency, smoother the cuts. But I was just discussing with one of my very close friends who were doing clear. The next day wow factor to get almost takes around 15 days to 20 days. So I don't know. There is really controversy while putting this slide. But this is I picked from one of the journal. So coming to the spot spacing, in clear it has got a overlapping. That might be the reason, probably the long duration for visual recovery. But in all other techniques, but as Kala said that in spot spacing in Silk, which is less than 1 micron, which is the unique feature of Silk. So laser pulse duration, of course, Silk has got a much lesser laser pulse duration compared to any other platform it's seen. So higher the pulse duration, what they say that the more thermal damage to the corneal tissue. Corneal cap thickness, I think in Smile, I have done Smile cap up to even 90 micron, but Silk you have to do, I think 110 micron is the cap, but Smile you can vary the cap thickness. In clear it is between 120 to 140 and smart light is 120 to 150. But what they say, thicker the cap, better biomechanical stability, I don't know. But when you are treating a very high refractive power, you have to take a very thin cap, then only the treatment will be perfect. You can save more tissue. That's what I understood. So residual stromal bed for Smile 250, but here nobody goes. In my case, with a very high refractive power, I still keep it around 270, 280. Sometimes I go with the Smile extra, with the I combine with the Smile cross-linking. So lenticule pattern in Smile, as I said that, for anterior it is circular pattern out to in. For posterior, circular in to out. In silk, it has got a radial pattern, clear circular pattern out to in, and smart right spiral pattern which is center forward. So suction loss again with the Visumax 500 years suction loss was high. In silk it is 0.32, but if you see with the Visumax 800, the suction loss rate is almost next to zero. So OBL was quite higher in the Visumax 500. Then, as Kala said that once you start doing your energy setting, this incidence of OBL will come down. Higher order abrasion with all these treatments are almost same, around plus or minus 0.26, which is similar in all of the cases. This is the cumulative comparison between Smile, Silk, Clear and Smart Light. The visual recovery after 1 week, 3 months, 6 months. In the end of 6 months, I think all treatment, I feel the results are fantastic. The only thing is, Smile, when you're docking, the amount of intraocular pressure it exerts on the cornea is around 20 to 30 millimeters of mercury in compared to Silk. And I think it was also the around 30 to 40 millimeters of mercury. Sometimes I think next day post-op patient with a tomato eye handle, the red eye might be much lesser in Smile compared to the Silk. Of course, compared to the PRK, LASIK and Klex, definitely Klex has got a faster recovery, shorter duration, less dry eye. But PRK again good for thinner corneas. But Klex, no flap related complication, better quality of vision, better biomechanical stability according to some of the studies. Of course, these are the advantage and disadvantage with all these procedures. Again, Klex still got a advantage on all these procedures. So I thank Jairaman for this opportunity. So I came all the way from Udupi, reached today early morning and part of this wonderful course. Thank you, one and all.